Hi everyone, thank you for being here. Today our group will be presenting on how AI tools perform when generating speech therapy material, specifically minimal pairs. We'll walk through what minimal pairs are, the client's profile, and the materials that the AI produced for us, and our evaluation of whether these materials were appropriate and useful in therapy. So I'm sure we're all familiar with minimal pairs, but just as a refresher, minimal pairs are pairs of words that differ from only one sound. They help children notice that changing a single word can change the meaning of a word. They're commonly used to target phonological processes like fronting, stopping, or leaving off final consonants. And therapy activities usually involve listening for the differences and practicing correct sound production.
Our client is 5-year-old male Jonathan Perez, presenting with a mild to moderate phonological disorder and consistent pattern-based phonological errors. His speech is most impacted by the primary process of stopping, demonstrated by consistent substitutions of F to P and S to T across word positions. In addition to stopping, Jonathan presents with velar fronting and cluster reduction. These processes reduce his intelligibility at the conversational level, especially with unfamiliar listeners. Jonathan demonstrates age-appropriate receptive language abilities. He participates well in structured tasks and responds positively to visual cues, verbal modeling, and play-based learning. His primary need is remediation of these phonological patterns to increase his speech clarity.
The form of AI that we used to generate the therapy materials was ChatGPT 5.1, the plus version. We asked the AI to please generate materials for a therapy session targeting this goal with specific client, male, Jonathan Perez, age 5, presenting with stopping, F to P, and S to T. The short-term goal would be that Jonathan will produce minimal pairs of sounds, syllables, words correctly on 8 out of 10 opportunities per session, targeting fricatives F and S in minimal pairs, contrasting their stop substitutions P and T after a period of 10 weeks with max cueing and fading, given visuals and visual cues and verbal models over 6 consecutive sessions. And they provided feedback with 2 different response options, with one being a little bit more specific than the other.
Here we decided to ask, give me one task for the minimal pairs activity, example picture cards, with a set of 6 words and a visual that goes along with that. So here you can see that it generated like a worksheet type of thing, but some of the pictures are pretty vague, such as the hand for pat or the vase for pour. Some of them just are also a little confusing, such as fun and pun or the one with Pete. And it also gave us 2 extra random pictures with no words attached, which is not exactly what we were looking for.
So for this slide, we put a few examples of the images the AI gave us while we were trying to create appropriate materials to work on minimal pairs. These were the results even after using multiple prompts, like asking it to create visuals for specific pairs such as pan and fan or C and T, and then asking it to double check the words because some still didn't match. But as you can see, the images were still inconsistent, mislabeled, or just totally off from what we needed. This shows how many attempts it took just to get something that was close to appropriate for Jonathan.
Here we have ChatGPT's best attempt at our minimal pairs activity. As you can see, the first minimal pair has the correct pictures, but the second card has the incorrect word. It should be fair, and instead it says fan. It would have been easier if ChatGPT just didn't put fan at all for that picture and just kept the fair. But the rest of the minimal pairs are correct. So we would use the bottom 3 pairs in our therapy with Jonathan.
Yes, the therapy materials were age appropriate because stopping of F and S is a common phonological process that is typically eliminated by age 4, and Jonathan is 5 years old. The meaningful minimal pairs approach is appropriate for treating the phonological process of stopping in children with mild to moderate speech sound disorders who are stimulable for the target sounds. The visuals in the therapy materials were clearly formatted to be stimulating to a young child and easy for them to identify, providing a distinct picture target for elicitation.
Did the materials that ChatGPT created target our therapy goal? Technically, yes, the material provided does target our therapy goal. However, the minimal pair that was formatted in error will not be useful in targeting our therapy goal, so we would not use that pair. Our minimal pair selection directly targets the stopping process, in which Jonathan replaces a fricative with a stop. The approach uses two words that differ by only one sound to highlight the contrast, such as so and toe. The differing sounds within the word pair include the child's error sound, the stop, and the correct target sound, the fricative. By facilitating a single fricative like F, this approach may help to facilitate subsequent acquisition of other fricatives, thus suppressing the overall stopping pattern.
How could it have been more appropriate? So first and foremost, it would have been more convenient and beneficial if ChatGPT itself provided us with a variety of detailed activity ideas instead of just listing the minimal pairs. Secondly, we would have liked to see fewer to no nonsense words, and it would have been nice if the words themselves were more age appropriate. So for example, at one point it generated the word fee as in F-E-E, which we wouldn't expect a 5-year-old to know. And this word would have also been very difficult to showcase as a visual anyways. And going back to his age, we would have wanted materials that are a bit more engaging, such as the creation of minimal pair flashcards or something of that nature that could have helped grab our client's attention more. Lastly, as you all saw in the previous slides, we were not able to get a worksheet that was 100% accurate. There was always a mismatched word or picture. Therefore, the overall materials would have been more appropriate had they all had visuals that actually matched the provided words.
So, was ChatGPT better than existing materials? The answer is no. The materials generated are not better than existing options. They were not created appropriately, and the minimal pairs were often inaccurate even when specific prompts were provided. Since Jonathan demonstrates stops of F to P and S to T, effective materials should present clearly developmentally appropriate minimal pairs that emphasizes the contrast between the target fricative and their substituted stop. The generated words did not constantly reflect these contrasts, and based on the materials that I have seen that specifically target Jonathan's need, existing resources appear to be more accurate and reliable for his intervention.
For question E, we decided we wouldn't use the AI materials in therapy. Even though it tried to follow our prompts, the visuals and word choices just weren't accurate or appropriate for a 5-year-old. We kept getting formatting issues, mixed up minimal pairs, and even misspelled words. For example, when we asked for visuals for pairs like pair and fair or C and T, it still gave us the wrong words or images. So overall, the materials weren't reliable, and we wouldn't feel comfortable using them for Jonathan's goals.